Welcome to the ITI Online Academy Learning module, Basics of Radiographic Assessment in Implant Dentistry, by Michael Bornstein. Radiographic imaging is an essential tool for dental implant planning. The aim of this module is to provide basic information, principles and recommendations for radiographic imaging in implant dentistry. The use of radiographic imaging modalities for pre-surgical dental implant planning should be adequate to provide information supportive of the following three goals. To establish the morphologic characteristics of the residual alveolar ridge. This includes considerations of bone volume and quality, vertical bone height, horizontal width, and edentulous saddle length. To determine the orientation of the residual alveolar ridge. This step focuses on the alignment of the implant fixture with respect to the prosthetic plan. To identify local anatomic or pathologic boundaries within the residual alveolar ridge that limit implant placement. This includes anatomical regions such as the nasopalatine fossa and canal, nasal fossa, mental foramen, submandibular gland fossa, mandibular canal, and local pathologies such as retained root tips, sinus disease, or adjacent inflammatory processes that compromise and limit implant fixture placement. Radiographic imaging techniques available today include two-dimensional imaging such as intraoral periapical, lateral cephalometric, and panoramic radiography and cross-sectional or three-dimensional imaging including tomography, multi-detector computed tomography, and, most recently, maxillofacial cone-beam computed tomography. The decision to use 3D imaging should be based on clear clinical benefits, given the additional financial costs and higher patient radiation dose. In this module, the basic information, principles, and recommendations for radiographic imaging are presented. They ensure that essential diagnostic information is obtained with as low as reasonably achievable radiation exposure according to the so-called ALARA principle. After completing this ITI Online Academy module, you should be able to list various modalities and characteristics of radiographic imaging modalities available for implant dentistry, state the ALARA principles and the radiation doses from different radiographic imaging techniques in implant dentistry, outline the reasons for performing two-dimensional versus three-dimensional radiographic imaging in implant dentistry, and describe the basic principles for the use of cone-beam computed tomography, or CBCT.
ITI Online Academy learning modules offer a wide variety of features to optimize your learning. Every module starts off with an introduction that is followed by the learning objectives, giving you an overview of the main topics and learning goals covered. Each of the learning objectives is discussed in an individual topic chapter that concludes with a list of its key learning points. The summary at the end of each module combines the major key learning points across all learning objectives for final repetition and focus. You are free to jump from item to item at any time using the module navigation. If you interrupt a viewing session, you can always resume it at a later time, at the exact point where you left off. The slides are enriched with interactive elements. You can expand literature references to get detailed information about the publication. In addition, you can look up definitions of specific terms, get further information about images, and enlarge images to scrutinize them in more detail. Every learning module is paired with a free assessment for continuing self-evaluation, allowing you to track your learning progress at any time. Take advantage of the Academy points earned in the free assessments to unlock learning modules free of charge. Unlock the complete learning module on academy.iti.org.